Over 6 million fans filled stadiums to watch the FIFA World Cup, but what they were really watching is anti-cancer physiology in action. What most people don't realize is that the same biological mechanisms that allow these athletes to perform are the mechanisms that suppress tumor development. In the absence of these mechanisms is where cancer risk increases. Physical inactivity is a major, modifiable risk factor for multiple cancers. This is because exercise positively impacts tumor microenvironments, insulin signaling, immune surveillance, and chronic inflammation. Mechanism number 1 describes how exercise reduces high insulin, the hormone responsible for moving sugar out of your bloodstream and into your cells to utilize for energy. When skeletal muscles contract, they act like a metabolic sink, absorbing about 80% of circulating blood sugars even at rest in the presence of insulin. A sedentary body is an optimal environment for cancer to develop and progress. Watch the video above to discover the characteristics of cancer cells. For mechanism number 2, this describes how exercise reduces pro-inflammatory markers. Cancer thrives in environments that are chronically inflamed. Exercise disrupts that environment. Mechanism number 3 describes how exercise affects the body's ability to detect and respond to cancer cells early on, before they grow into large masses. Early tumor suppression is immune dependent. An active body is one with a more efficient immune system and a greater ability to fight cancer cells. Mechanisms of action are compelling, but in oncology, mechanisms are not enough. What matters is whether these biological effects of exercise translate into real-world reductions in cancer incidence and mortality, and they do for 4 cancers. For colon cancer, the data are among the most consistent in exercise oncology. Patients with the highest physical activity level have a 20 to 30% lower risk of developing colon cancer compared to the least active patients. Colon cancer risk declines as weekly moderate to vigorous activity increases. In the challenge trial, a large, international randomized controlled study, which included 889 study patients with stages 2 and 3 colon cancer post-surgery and chemotherapy. A 3-year structured exercise program improved 5-year survival from 73.9% to 80.3% and reduced risk of recurrence or death by 28%. In breast cancer, particularly in postmenopausal women, higher physical activity levels are associated with a 10 to 20% reduced cancer risk. The effects appear to be strongest for hormone receptor-positive disease, suggesting that endocrine modulation may be one way that physical activity reduces breast cancer risk. Endometrial cancer is often overlooked, but research demonstrates one of the more pronounced associations between exercise and cancer risk. Some studies report independent associations in endometrial cancer risk reduction approaching 20 to 30% among the most physically active women. For prostate cancer, a large systematic review and meta-analysis of 43 studies found that men who were more physically active had a 10% lower risk of prostate cancer. In multiple cancer populations, greater physical activity post-diagnosis correlates with improved outcomes, reduced risk of cancer recurrence, and all-cause mortality. The biological difference between an active body versus a sedentary body is not cosmetic, it's molecular, with differences accumulating over decades. The World Cup celebrates elite human performance. Cancer research shows us what happens when exercise disappears. Exercise is not a cure for cancer or a guaranteed prevention tool, but it is one of the most powerful non-pharmacologic modulators of cancer risk that we have, and its benefits greatly outweigh its potential harms. Subscribe for more cancer info from a scientist and 3-time survivor.